We appreciate you. Just want to give another shout out and thank you to every single one of our AALC committee members that is on this morning. I can tell you that it means a lot to us, the work that you do for our community. We work so hard and we work hard together to make an impact. So I just thank you all for being on this morning, especially again to all of those, again, who helped also contribute to this lunch and learn. And we just want to say that we appreciate you so much and thank you for your commitment, for your gifts, for your time, everything you do for AALC. Of course, I want to give a special shout out to our chair who's here with me this morning, Stephanie, she is our vice chair and she does such an amazing job. She actually conducted, again, a lot of the putting together in the background for this. So a special thank you to you, Stephanie, as always. And you know that every single one of you mean a lot to Stephanie and I. So I want to go ahead and also give a special thank you to, which I know they're not expecting it, before we get started, to our own Amy, Alex, and to Terry. Believe it or not, again, they have done a lot in the last couple of months getting us ready for today, and it is not easy. So we just want to give a shout out to the three of you and to tell you thank you so much for all your time and dedication, not only to AALC, but also to Trident United Way. So with that said, I want to actually just talk to you all just briefly about what AALC is. What is the African American Leadership Council? We do a lot for our community. And we're engaged, we're passionate, but we are leaders from all over the actual, again, Tri-County. We are here and motivated to be, again, African-American philanthropists for the work that Trident United Way does and to help fulfill the mission. And, of course, those missions are education, financial stability, and, of course, mental health. It is very important to every single one of us, and you'll know that if you're ever in a meeting, we are very passionate, we're very engaged. Every single one of us has a work that we're trying to do, and a part of that work, of course, is why we're here today. So again, we are all about our community. One of the biggest things that I will say that we do with our community that is such an impact, and it's one of the things that drew me to Trident United Way, is the work we do with our book drive every year. And I think that, again, in the light of COVID, everything changing, this year, again, even last year, was a little bit different for us than what we've had to do, but we made it work. Our committee decided that we would go out in the community and still give books back, but we have literally collected thousands of books. We went into the classroom, engaged with our students within our Tri-County area, and we literally have read to each one of them. We've actually taken the time out to, again, not only, again, engage them with reading, but we're following up with those with other programs, again, through Trident United Way. So with that said, why is Trident United Way important to me? Why is AALC important to me? It is important to me, I will tell you, because my own father could not read until he was almost 40 years old. So the work that we do, it means everything. Our children need to know how to read. They need to know that we care about them. And to see our faces out in the community as African American Leadership Council members going out there and being with these kids and helping them, again, it means everything to our community, but it also means a lot to me personally, because I know my father would have benefited from that so much if he was able to have just a piece of what we're giving to our community out there. So again, to our AALC members, thank you. This is what we do. We do it well. You'll notice that today as we go forth as well in our presentation. And the other thing I wanted to mention again as we go into this actual discussion, again, this event today is all about mental health. It is all about making sure that, again, we're able to update you on the work and the things that we do within the community and to engage you, ask questions, again, or answer your questions in regards to what, again, mental health is doing within our own communities, within our own walls. Very important. So today we will actually have the update coming from one of our own Trident United Way, again, team members, which I'll introduce her in just a minute. We will follow that with an exciting presentation by all three of our actual experts from the South Carolina Department of Mental Health. Very, again, excited to hear from all of them today. After that presentation, we'll actually proceed getting some questions from you all, of course, through the chat. Again, engage us with that and come on through. And of course, that chat will also again be led by our awesome Stephanie, who is our vice chair. Throughout the presentation, again, continue to submit your questions. We want to hear from you. We want to have you engage with us because this conversation is for us. It's about us learning and growing together. And finally, again, we will also ask you poll questions. So please go ahead when those poll questions come up. We want you to actually, again, give your feedback on them. Tell us how you're feeling, what you're thinking. And again, engage us throughout this actual conversation. So thank you for being here again. We appreciate you more than I can tell you. And again, I know that you're about to learn and grow with us. And with that said, I want to introduce you again to our Trident United Way Director of Health, Renee Lynn-Gary. Renee, turn it over to you.
Thank you, Sonya, and great introduction. So, as the Director of Health here at Trident United Way, I just want to remind you our mission here at Trident United Way is to be the catalyst for measurable community transformation and education, financial stability, and health. And we have a vision to be the leader in uniting our community to improve lives. In order to make that work, we have to make sure that we have long-lasting change through our collective impact initiative, which is a systemic approach in which many partners agree to advance the work on how we will approach the issues at hand in our community. And particularly here at Trident United Way, in my role as the Director of Health, leading and facilitating the health area of the work, we are one of those collective impact initiatives outlined here at Trident United Way. Next slide. So today I just want to give you a brief overview of that collective impact initiative called Healthy Tri-County and the work happening particularly under behavioral health, which addresses the issues and concerns under mental health, which is what the topic today is about. And so at Healthy Tri-County, we came together as the backbone organization of a collective impact strategy. And with that, we came together with Groper St. Francis, Trident United Way, and MUSC in 2016 to conduct a community health needs assessment. When we came together in 2016, what we realized was that we could do more than just implement the community health needs assessment. Next slide. And sorry, I lost the screen there, Terry. As she brings that back up, I will just go ahead. Healthy Tri-County came out of our 2016 community health needs assessment, and we came together and launched Healthy Tri-County in 2017. It is a multi-sector regional initiative to improve health outcomes in Berkeley, Charleston, and Dorchester counties with our long-term aspirational goal to improve the health and well-being of every person and community within the Tri-County area. Our Tri-County area has a very complex health landscape and system, and therefore we know that no one organization can do this work alone. And out of our Tri-County health community health needs assessment, we found that there were some top priorities that we heard from the community that were identified. Next slide. Here you will see the 5 top topics that the community said we had some gaps and challenges addressing and getting into care. And so the first there you will see on the slide is access to care. From access to care, the other top priority is behavioral health, clinical preventive services, obesity, nutrition, and physical activity, maternal, child, and infant health. And in all these topic areas that were identified by our community through our community health needs assessment, we see that we view these topics through a lens of health equity and social determinant factors. All of our current work efforts align with these 5 top priority areas, and we as a community came together again with that United Way as the backbone organization leading the work and structuring the work to develop a Tri-County health improvement plan. Next slide. In that plan, which is available on our Healthy Tri-County website, the community came together once again to strategize together about how to address the concerns of our community in those 5 top priority areas. As you see here, behavioral health, which encompasses mental health, outlines what the 2 priority goals are to increase the Tri-County knowledge about behavioral health issues and services, as well as the resources in order to reduce the stigma and increase service utilization. And then the second goal is to improve access to and utilization of behavioral health services for all of the Tri-County citizens. And so along with our Tri-County Health Improvement Plan, which is a 5-year plan, we also have a community action guide that is complementary to the improvement plan, and it gives individuals, civic organizations, and businesses, and all stakeholders in our community some key tools and takeaways about how they can engage in the work under Healthy Tri-County, how they can collaborate to get to action and make impact. So with that, we also have to remember that mental health is an important part of our overall health and well-being. It affects how we think, feel, and act. It also may affect how we handle stress and relate to others and make choices during emergency times like now with the pandemic. I want to thank the African American Leadership Council and the steering committee for taking the time to make health a priority topic today, particularly mental health for this Lunch and Learn. I also welcome you. This is the brown bag edition, so I ask you to unpack and be prepared for the discussion today around mental health. This alone is an activity that aligns with our health improvement plan, and you're making a big impact by being a part of the session today and learning from our local experts about ways that we can address the stigma behind mental health and all those health disparities and health inequities that we see in mental health in our area. With that, I thank you to Sonya and Stephanie, and I will turn it over to Stephanie Singleton, the Vice Chair of our African American Leadership Council.
Thank you so much, Renee. Renee, again, is the Director of Health at Trident United Way, and again, I am Stephanie Singleton, the Vice Chair of African American Leadership Council of Trident United Way. Thank you for joining us. We're excited to have you all. We are at, it's like almost 64 participants today. Exciting. Again, to piggyback off what my wonderful chair has said, Sonya, the AALC, every year we decide to do a lunch and learn where we choose a topic of health and discuss how it is, how it impacts our community, our people of color, and we talk about that. We want to bring awareness to it, and it definitely ties in this year in particular to the Healthy Tri-County motives and health equity. So with that said, we're going to talk about mental health, especially during this COVID season, right? Got a lot of things going on. I'd like to introduce our panelists today. I guess they come from the South Carolina Department of Mental Health. First, I'd like to introduce Sonya Jenkins. Sonya Jenkins is County Director of Charleston Mental Health Center, West Ashley Clinic. She has more than 25 years of experience in the field of mental health, providing treatments to adults, children, adolescents, and families. Her aim is to provide healing, support, in a safe and healthy environment. Oliver on. Karen is the Dorchester. She's at the Dorchester for Charleston. I'm sorry. Let me get it right now. I'm sorry, Karen. Karen is at the director. She's the director of the Charleston Dorchester Mental Health Center. She has over 18 years experience in working with families dealing with mental illness, and she is a tireless advocate of meeting people where they are. Okay. We also have Ms. Yolanda Sanders. Now, Ms. Sanders is a native of the Low Country, and she has a bachelor's in psychology and a master's in human resources and counseling. She is an alumni of South Carolina State and Webster University, fellow alumna, and she is in the tri-base. So we are excited to have the three of them. We also have on the panel today Mr. Miller Frazier, who is the administrator of the, Charleston Dorchester Mental Health Center. And Ms. Frazier has over 20 years of mental health experience. So between the four of them, we are going to have good discussion. We're going to get into the weeds of mental health, how it impacts our communities, what we need to do to address the stigma around mental health, and hopefully get some good chat questions from you all. So our chat is open. Please go in there, ask the questions you'd like to have asked, and at the end of the presentation, we're going to get into that. So with no further ado, we're going to turn it over to our panelists.
Good morning, Ms. Stephanie. Good morning, AALC. I so appreciate the time that you've let us come to do this. I am Jamila Frazier, the administrator here at the Charleston Dorchester Mental Health Center. Sorry, we're socially distancing to figure out the room. But thank you so much for letting us be here and share. As we said, we are the Charleston Dorchester Mental Health Center. We have two clinics, one in West Ashley and one in Somerville. I've listed our website here below as well. Next slide, please. Present with us today, we've got Karen Oliver. She's our Dorchester Clinic Director. Yolanda Sanders, she is our school-based supervisor for school-based services, and she is our youth mental health first aid instructor. I serve as the administrator, so I'm handling everything non-clinical. And Sonya Jenkins is our Charleston County Clinic Director. Next slide, please. Oh, previous slide. Wonderful. So here at Charleston Dorchester Mental Health, we serve people in Charleston and Dorchester counties. We've got about 5,900 open adults, children, and their families engaged in treatment. Of that, a third of those are children, but we are a big provider of services for African American people in this community. 47% of our patient caseload is African American, whether it's children or adults. We are one of 16 mental health centers and the second largest in the state. And the great thing about having a state agency mental health is that we have continuity of care across the state, which is really important for the Black community because we sometimes, in trying to seek treatment, sometimes it's a barrier trying to go from one place to another. If I move from Charleston to Columbia and have to find a new therapist, that can be a barrier to me continuing treatment. But because we have one unified state system, that barrier is significantly reduced. Next slide, please, and I will let Karen Oliver take over from me.
Good afternoon. Our mission is to support the recovery of those with mental illness. We are committed to eliminating stigma. Our goal is to improve the quality of life, provide more job opportunities for our patients, and participate in anti-stigma events like today's event, and also to provide access to care. And by providing access to care, we'll be able to decrease hospitalization, incarceration, homelessness, and suspension. Next slide, please. At the Charleston Dorchester Mental Health Center, we offer a wide variety of treatment services for our children, adolescents, and families. Our assessment mobile crisis is a 24/7 psychiatric assessment team serving throughout the Tri-County area. And this crisis team diverts individuals from having to spend a whole lot of time in the ER by linking them to appropriate care. Our school-based services, we currently have therapists covering all the schools in the Charleston and Dorchester schools, so we're definitely excited about that. Since the pandemic, we have offered telehealth services, we have doctor-to-doctor, face-to-face services, telephone services, and these platforms have been approved by our Medicaid office and by the South Department of Mental Health. Our therapists are actually working non-traditional hours to meet the needs of our kids and families and our adults. So we have definitely embraced the all-hands-on-deck concept when providing services to our patients. Our Highway to Hope is actually our RV that goes out to the different communities, especially our rural communities like McClenaville, St. George, Edgefield Island, and Johns Island. We also offer crisis stabilization to our patients and to the community. Our crisis stabilization unit is a 10-bed voluntarily unit in our area. And this unit is designed to provide urgent care for individuals experiencing psychiatric options. This is an average, this has been an average of 3.5 days here, and we accept admissions 24/7. We also assist our patients with individual placement and job opportunities, and have a team designed to provide treatment to patients who have experienced a first psychotic break. Another service we offer is our home care program. This is a service for our patients who previously resided in a long-term state psychiatric hospital facility and have now chosen to live with providers that's willing to care their home, so that's why they call it home care. We also offer bilingual services to our patients. Next slide, please. Okay, now let's shift a little bit for on tips on how to handle this stress. Everyone reacts differently to stressful situations, right? For me, I love these. So let's take a look at some of the tips that we can use to take care of ourselves during this pandemic. It is important for us to have a healthy habit, maintain a routine that will help relieve anxiety and stress. What about taking care of ourselves? It's okay to be selfish, and I've been very selfish in this pandemic. I've been learning how to take care of myself during the pandemic. So it's okay to take a break from watching, reading, or listening to news stories, including those on social media right now. Go for a walk, get some sun, enjoy your favorite hobby. Like I said, since the pandemic, I started making candles, I started gardening, and I'm just, taking care of myself. So, ladies, gents, we have to do what we have to do. Try not to overindulge in wine, candy, chips, soda. Remember, everything in moderation. You don't need to do this alone, so reach out for emotional support also. Schedule a virtual therapy session. Schedule a virtual brunch with your friends, or treat yourself for a nice one. And remember, it's okay to be kind to yourself and others during this time. Next slide, please. Now, I love working with kids, and I just want to take a minute just to focus on our kids. Let's face it, this pandemic has changed our lives in ways we would have never imagined. Many schools and businesses are closed or running remotely. Kids along with our parents are feeling a bit overwhelmed. So let's take a look at some of the challenges that our kids face during this pandemic. The first one says break in continuity of learning. Our kids actually went from a face-to-face learning to virtual learning overnight, right? For my nieces and nephews, remote learning was a bit of a challenge at first, but I think they're okay with it now. But studies have shown that children learn well when they are actively engaged in environments where they feel safe and socially connected. Let's look at breaking continuity of healthcare. Our kids miss a lot of well-check appointments, and for those kids receiving special services in schools such as occupational, dental, and speech therapy, those services are now limited. Now, just to elaborate on the mental health piece of that, like I mentioned before, we have counselors in all of our schools within the Charleston and Dorchester districts. And one of the services that I am thankful for are the variety of platforms that became available during this pandemic. Our center went from providing majority face-to-face therapies to now, like I said, telephonic, Docs.me, Google, and some FaceTime if it's with teenagers. Another challenge everyone is facing are the missed life events, birthdays, graduations, vacation plans, especially with the holidays approaching us. I'm thinking, well, I'd be able to have Thanksgiving dinner, the traditional Thanksgiving dinner, right? So I find myself constantly worrying and overthinking about this because this is one of my favorite holidays. So just imagine how our kids are feeling. So remember to take care of yourselves, be kind to yourselves, be kind to others, and remember for everything there is a season and this too shall pass. Next, I'm going to pass it on to Ms. Sonya, our clinic director at our West Ashland office. Ms. Sonya.
Good morning, everyone. Next slide, please. Why African Americans are less likely to go to therapy. This is going to be an engaging topic for everyone. I want you to put in the chat box some of the names you hear when someone has a mental illness. Just type in some names that you hear other people call them when someone has a mental illness. I see so far crazy, pretty loose, crazy, not psycho, immature, very good. Tact, fool, y'all are so correct. So that is one of the reasons people do not come to mental health, because of the stigma. I want you to think about two types of stigma. Social stigma, and when I think about social stigma, I think about people discriminating against someone, an individual, but also perceived stigma. That is self-stigma to me. So I already feel bad about myself. I already have a stigma on myself if I have a mental illness. I'm already saying they're going to call me these names. I already feel like people are going to discriminate against me whether they do it or not. I already feel the shame and guilt of having a mental illness. So these stigmas create a lot of problems for African Americans to go to therapy. Another reason is poor reflection on the family. When you think about a family name, if we think about how family names are carried on from one generation to another, if someone with a mental illness, they don't want the family name to be, oh, that person is crazy in that family. That person is fool. That person is a psycho. So it has a reflection on the family. And then we have to think about the cost of care and the lack of insurance. African Americans has lack of health insurance. They do not have health insurance, and it creates problems for them to receive care. And the good thing about being in South Carolina, we do have a mental health system where if you do not have insurance, you can still receive help. And it could be at a very small cost or no cost. So the good thing about South Carolina, we do have the mental health system, and that we have an opportunity to receive services, and it's just not a watered-down services that I am so happy about. And like Karen was telling you, all the services that you can receive in Charleston, South Carolina. Next slide, please. Then it comes to being concerns about therapists or the process. Some of the concerns are, who do I go to? Lack of education. How are they going to perceive me? What are they going to say when I go there? Are they going to think that I'm crazy? Are they going to put a lot of medication in my body and just offer me medication? And because what we have had in the past, we have some fear of taking medication, not knowing if this medicine is going to help or it's going to hurt. Sometimes with using medication for mental health, it is a trial and error, and someone sitting down and talking to you, okay, we're going to start you on the lowest dose, and then we're going to increase the dose based on your needs. If they do not trust the person that they're talking to, and they are not feeling like this person understands them, then they become fearful, like, are they just calling medication on me, and I am going to have to take medicine every time I go there? They're increasing the medicine. That's where comes the lack of education and feeling like it's only happening to us. And then we have another problem, lack of representation in the field as African Americans. We have less African American males in this field. And I must say it's very hard because the field does not pay a lot when you're the therapist. So we have a lot of things that really hinder and have concerns about the process. And I can tell you at the Department of Mental Health, we try to hire as many qualified African American males and African American females to represent us in our field. And so we always have openings. If anyone has a master's degree and looking for a job, we have an opening because we really want to bring people of our culture to serve the people of our culture and to understand them. Sometimes we talk and our speech may be different. And I always use this example. Someone may say, "How are you doing today?" I say, "I am fine." What that fine means to you may not mean the same to me. And what I ask them, when you say you're fine, are you frustrated? Are you insecure? Are you narcissistic? Are you emotional? Because fine means many things to different people. And to really understand the culture of what fine means, you have to really ask the question. And you have to continue to ask questions if you don't understand, and allow them to explain it, allow us to use different tones of voice, because every time we use a loud tone of voice does not mean that we're psychotic, but allowing this person to really express themselves. And so I know that we teach this at our center, being very culturally sensitive to meet the needs of our people. But those are some concerns. And we're going to have some discussions after the presentation. I want you to really talk to me, ask questions, and tell me your concerns, because what we want to do from this presentation is to bring it back to our center and to continue to educate everyone on how to respond and what to do when things are going on. Next slide. And I know everybody out there is saying, what can I do to assist? How can I help? Well, one thing we have to start working on as a community is to look at affordable treatment, not just at the mental health center, but look at affordable treatment out in the public sector too. For those who feel the stigma and feel like they cannot come here, how can they afford to receive private care treatment? And then we cannot be afraid to ask and talk about mental health. We have to be able to ask the questions. And we're going to talk a little bit later in the other slide about how to ask these questions, because we have to ask someone, are you suffering from a mental illness? And we have to be able to recognize what we need to do. And most importantly, we have to make mental health a priority. And we have to make it a priority for ourselves and for your family. And what I want you to really think about making it a priority, and I didn't talk about it in the previous slide, is in our churches. As African Americans, sometimes we suffer because we feel like we can pray it through. And I am a believer, and I believe in prayer, and I know that prayer helps, and I know that God is almighty. But He also gives us the wisdom to know when we need help. We have to treat mental health as though if someone has cancer. If someone has cancer, we're going out to visit them at the hospital. We're going to carry them a care package. We are going to do everything possible to make that person comfortable. When you think about mental health, we tend to get that stigma. We must break down the stigma of mental health and treat it just like any other health illness. We really want to push forward with mental health and break down the stigma of mental health. And the next thing is, I'm going to move to the next slide when Yolanda's going to talk about take a mental health first aid course. She's going to tell you about the importance of mental health first aid and how to do it, and why we know that it takes a village to raise a family, and you are our village, and you're the person we need to speak to. Thank you. Next slide. We're turning over to Yolanda.
I'll be speaking on mental health first aid. Next slide, please. Mental health first aid, it was developed in 2001 The purpose of this course was designed to teach lay people how to recognize the early stage of a mental health problem or a mental health illness. Okay, this training can be done in person or it can be done through Zoom. It is an 8-hour training. It can be done in 2 parts, 4 hours, one day, 4 hours, and another day. The purpose of this course is not to diagnose or treat a person. This course is just to help you understand the early stages and to provide them with professional help. So, and to direct them in the direction to receive professional help, like from a therapist or a psychologist. So you're wondering who could benefit from this mental health first aid. Next slide, please. Anyone that deals with children or have any type of interaction with children, whether it's a janitor in the school or if it's a football, basketball coach, it may be a pastor, it may be a Sunday school teacher, it can be your teachers in the school, anybody that have an interaction with a child could benefit from these services. So this is one way where we can bring the community together to stop the stigma with mental health and to begin to treat people with mental health illness is by taking this course. This course will give you a better understanding of the signs and symptoms of mental health, of a person who has a mental health problem or maybe in a mental health crisis. So what can you do as a person? You can take a course, you can strengthen your community by doing this, and you can save a life. So at this time, we're going to open it up for any questions or discussions.
Okay. Thank you so much for all of that information. We really appreciate the information. So we were sitting here getting into it. So you kind of caught us off guard. Fabulous. We were talking about it and saying fabulous information. So we have some information in the chat. We have some questions in the chat. We have some questions that we've assigned. Okay. Can you hear me? Okay. What we'd like to know for any of the panelists is, has there been an increase in the number of people presenting for mental health care since COVID-19 hit?
I am going to speak for the Charleston Clinic. We have had a 50% increase since COVID, since the COVID pandemic. We're noticing more increasing. I don't have the stats for the last month, but it has been a great increase, and we're seeing more patients outside. And we also have a mobile crisis team that goes out. So we have a 24-hour, 7 days a week, where someone can call us, and if we may have to go out to see them. So yes, I would say we do have a great increase.
I agree. At the Dorchester Clinic, we definitely have seen an increase in the numbers of referrals, especially for a school-based referral. I just want to also share with you guys that we have clinicians embedded in all of our police departments. So we have all our police departments, all of our Sunville PD, Charleston PD, North Charleston Police Department. So that's another services that we offer to the community, is that we have qualified mental health professionals at all of our police departments.
Fabulous. Well, a 50% increase. That is, I feel like that's a good thing. People are are aware that they need to talk to someone, or that they're having a crisis that they cannot deal with. So I'm glad to know that number is increasing for health, at least. So we have a question from Abby, and she would like to know, how does she enroll to take the training that you mentioned?
Okay. The training is done based upon who wants it. So we can do a training like if you have it as a church, but we do ask that we have a certain amount of participants to participate, and we can provide it at any time. At least, I would say at least 10 participants if we're going to do in person. And we also can do it in Zoom, so we probably say at least 10 people.
Okay.
Stephanie, before you move on from that, I want to chime in on also about the mental health first aid. I know Yolanda talked about the child piece, but we also have an adult mental health first aid for those who are encountering mental health adults. So there are two different types of training. There are one for the adult and one for the child. And just like Yolanda said, we asked at least 10 participants for us to do the class. I would like to offer, if you're interested in a class and you email me, I will let you know when the next class will be. So if you're just a one person, you can email me and say, when you have your next class, I would like to join it. I will let you know if it's going to be by Zoom or will it be in person and where it will be. But I will keep a running log of those who would like to participate in our next training.
Good information. Thank you, Sonya. We have another question from Letitia. She asks, how would mental health services look for families with young children? I'm imagining that this question probably is, does the family come in? Does the child come in alone? I'm imagining that.
So for our kids, if they actually attend one of our schools within the Charleston, Dorchester district, we provide school-based services for them. The parents do have the option of opting out of school-based services and they can come into the clinic. But our first option is to provide school-based services within that school. Like I said before, we do have full-time clinicians at every one of our schools within the Tri-County area.
Okay.
Stephanie?
Yes.
This is Jamila.
Yes.
And I'm just going to talk about it from a personal perspective.
So Jamila is running across to the office. There we go. Sanders.
About how families engaging in treatment look. So my kids, and it's been big things like my daughter had a classmate that was shot in 5th grade, where she had to go to grief counseling, she talked to a counselor, she went to grief camp. So little things like my other daughter was having a her and her Nana were butting heads. And I can't fix Nana, but I can help my child get tools to help regulate herself so that Nana and her don't butt heads. So there's a lot of individual giving the child an opportunity to talk to the therapist individually, because she may not share when I'm in the room. But there's a lot of family therapy as well, where we're all together and they're giving us tools to interact and communicate in a healthier way. And I know that's me outside of here, but mental health here, we provide a lot of family therapy, particularly for our school-based services, because if the child is struggling and we work with the child on coping mechanisms, but the parents don't have the tools, then we're working against ourselves a little bit. So I just kind of wanted to address it from a personal perspective and be an example of someone not afraid of talking about having my kid in therapy or talking to a therapist or our family talking to a therapist to get those tools.
Thank you so much for that transparency, Jamila. That's what we need, and that's what this format is for. Whether you want to do it on camera, whether you want to do it in the chat, whether you'd like to send emails to the panelists, they all have included their information in the last slide of this presentation for emails for follow-up questions. We're getting a lot of interest in the training. So again, could you go into just a little bit more detail about the training, that first aid training that you have, maybe a couple of examples of how it works, how you get into it, what people can expect to learn from it, because it's blowing up in the chat room about this training.
Okay, so the mental health first aid is a training that we provide, like I stated earlier, is we try to get at least 10 participants. It's not a cost for us to do it in person, but I think due to Zoom and having to pay for Zoom, there is a cost to do it virtually. And Ms. Sonya can elaborate on how much it is when we do it Zoom. But in person, it is not a cost. We can do it during the pandemic if we put in, the social distancing and, limiting how many people we do have in the training. Also, with mental health first aid, the purpose of the training is just to understand the early stages of seeing someone that may have a mental health problem or maybe experiencing a mental health crisis. So in this training, you're going to understand and you're going to better recognize signs and symptoms, whether it's physical, whether it's emotional, whether it's coming from a behavior standpoint or a cognitive standpoint. You're going to be able to recognize these signs and these symptoms. And by that time, when you're able to recognize it, your goal is not to diagnose, your goal is not to treat. Your goal is to set that person up to seek professional help. So then you will pass that torch on to someone like myself or someone like Sonya or someone like Ms. Karen to further assist this person on getting the treatment that they need or the medication that they would need. And like I said earlier, that the training is an 8-hour training that it can be done in 2 parts where it's 4 hours this day and 4 hours the next day. If we do it 4 hours, it is recommended that we do it within a week time frame of each other. So if I did 4 hours on Wednesday, the next training has to be done by the following Wednesday.
I think Yolanda did it so well together, but I want to give you something to think about. So depression. When we think about depression, we think of someone who may be sad, who is sleeping, and that's how depression may show up in an adult. When we think about depression in children, the behavior is totally different. What we notice is a child can be depressed and start acting out. So you see these behaviors just popping up and everybody's going like, what happened? What is going on with Johnny? Johnny never acts that way anymore. Not thinking that Johnny may be depressed, but more thinking that Johnny is just having a behavior problem. So what we do is we try to help you recognize what is going on with the person or the child so that you can then make a good assessment to help them get to the help they need to the professional. And it doesn't have to be with us. We can help you seek treatment anywhere that person wants to go, and that's what we'll help you learn.
Speaking of that, Sonya, thank you for that information. We did have a question about that. So a person wanted to know, where would someone seek help in Berkeley County? And that just, you segued right into it.
Berkeley County has a mental health center in their county. So I think it's in Mounts Corner, but they have a mental health center. But I also would let you know that if you call Dorchester County and you have a private insurance, or you call Charleston Mental Health and you have private insurance, we try to help you find services that will be covered by your insurance or somewhere you need to go that's really going to meet your needs, because everybody's needs are different. So I always say reach out first to your local mental health clinic, find out can they meet your needs. If they cannot, can they recommend someone in the community to meet your needs? Please remember this as people go try to seek treatment. I always tell them it's a process, and that's something in the mental health first aid you can learn. It's a process. So the first time or the first 5 times you go to treatment, you're not going to get better. Sometimes you're going to get worse before you get better, because we're going to start tapping into things that you thought it was your mama dying, that is really something has built up over years, that you have had a trauma. So it's a process, and I try to explain that to African Americans. Don't give up on the first 5 tries. Come again. Continue to go. Make sure that therapists understand what you're looking for so that you can stay engaged into treatment.
Fabulous. We're over here smiling because everything that you are speaking on is coming up in the chat, or coming up over here at Trident United Way in the periphery here. So much interest in information going out. So we do have a question. That the question is, with COVID-19 being a prevalent topic in finances, healthcare, mental health care, everything, are you finding a particular diagnosis or mental health concern, like depression, because there are a lot of kids who are doing the hybrid learning, are at home and unable to go to school? You talked about the children earlier, but I think the question wanted to know, is there a particular diagnosis that you all are seeing more of right now, especially with children?
For children, I would say anxiety. I'm trying to if you could agree with me on that, Yolanda, absolutely, Yvonne. I would say anxiety with our kids, and some opposition on the science, but that can also look like anxiety, so I would just go with anxiety.
I would have to agree with Karen with that on the anxiety. I think that the anxiety is bringing more people to come to treatment because it's becoming overwhelming to them, where they may have other underlying diagnoses, but the anxiety is the driving factor. Because now they are shut up, they're in close proximity of each other, and they're not able to move about, communicate as frequently, so it has created more anxiety that now we're going to figure out later, I believe, they have some underlying issues that are going to bring out other diagnoses in the future. But I would agree with Karen on the anxiety.
Fabulous. Okay, so we have a question from Dana, and she's asking, are there virtual options for mental health services? What about text messages, based therapy? Again, that leads into the telehealth aspect of it. So what is an option for those who may not be able to come in? Are there telehealth options for mental health?
Yes, there are both, we can do both telehealth and face-to-face for both our school-based and our adult clinicians. So since the pandemic, we have pushed out our telehealth services, and at times, if they have an iPhone, we do the FaceTime as well. But currently, we do not offer text messaging services. But we do offer telehealth and face-to-face if the family would like.
I can tell you a little reason why we do not offer the texting. That could become a liability, because if you start texting and we don't know where you're at and we get information. So texting for us is not the best. Although we use the telephone, our preference is to do the doxy.me, the telehealth, and the second would be our phone services. But first, face-to-face telehealth, then phone services is our 3 priority at this time.
And we've been open since the pandemic. We have not closed at all during the pandemic. In fact, we have extended our hours, so we're working non-traditional 9 to 5 hours also.
Okay, so that would be doxy.me, correct? Fabulous, fabulous. And is that one of the links that is in the last slide?
No. In order to get to the doxy.me, you would have to have a therapist, and we would have to invite you in. It is a telehealth services that we use just to provide treatment over. It's supposed to be more secure than a Zoom or other web bases because it's really been for telehealth.
Okay. Thank you for that clarification, because now we've got a lot of questions. Okay, so we have a lot of questions coming in, and I'm going to try to wrap some of them into one, because you all are touching bases on them, bits and pieces. So we're going to go back to teachers and in the classroom. Is there a particular training, and Yolanda, maybe this is your area, but is there a particular training for teachers for recognizing potential mental health concerns?
That is the mental health first aid.
That is the mental health first aid. Okay.
Yes, and I also put in my email address, so if they would like training, if they deal with children on a day-to-day basis, I put in my email where they can email me one-on-one, and then if I have enough people sign up, I'll set up a day to train those people, and I also will have a co-trainer with me as well. Her name is Lisa Brown. So we will provide that training for anyone who will email me and would like to do the mental health first aid training.
Stephanie, if I may add, we work closely with all of our school districts. We have a great relationship with them. And I know for DD2 and DD4, we're actually working closely with Dr. Lady and their as far as providing them training on what to recognize and how to recognize them. So they know the ground, the ground level, the groundwork of what to look out for. So we have a great relationship with our teachers and principals at all the schools. So yeah, please reach out to us as far as trainings. If you need any type of training, we definitely will help you and something like that.
Other thing I'll add, Stephanie, is we do an annual conference called the Low Country Mental Health Conference. It's at we usually have about 1,200 attendees. A lot of teachers attend that. And I'll tell you from personal experience, my daughter had a real hard time in second grade, and a teacher kept butting heads. She got to third grade, and that teacher talked to her about journaling, and it changed her whole school experience. But that teacher has gotten some of that advanced kind of mental health training on her level to be able to redirect my daughter with journaling to help her focus her thoughts and then be able to stay focused during class. And that's every summer. I believe it's scheduled for either the end of July or early August in 2021.
Wow. Okay. I don't know if you other 60 participants on this WebEx are getting this, but you all are getting some one-on-one, in-depth, straight to the source resources. Thank you all so much for this information. You're getting direct email to people that you can have an answer for your particular situation. We are going to start rounding up the chat questions, but there are a few things we do want to talk about. And so there has been a question about first responders. And with everything that's going on with marches and everything that's going on in our society, just from top to bottom, in and out, do first responders have do you find that first responders are taking this course to learn how to identify a potential mental illness versus just saying, I think one of you said earlier, oh, so-and-so's just acting out, or you see someone out in the street and they seem to be acting out. However, it could be that they are experiencing a mental health concern. So do first responders have a particular course that they take, or do you offer something to them?
We do. We have a crisis intervention for first responders. We are always making sure that they are trained and they're equipped to handle the medically ill. So police officers, people who are just layperson and the first responders. We also have something on the EMS. So when EMS goes out to see a person, say someone called just for, say someone's acting out or they're different, we can also see this person through telehealth. The EMS has the capability of showing us what's going on, what the behaviors for us to talk to that person on site. Karen is going to be able to talk a little bit more how we do our 24 hours, 7 days a week weekend calls, our call center. So we are really working closely with our first responders.
Thanks, Sonya. We have a call center. We just inherited this call center from our Greenville Mental Health Center. So we are blessed to have a call center located at our West Access Clinic off Charleston Boulevard. And this is a 24/7 call center. And this call center consists of us receiving all the calls from all 16 mental health centers. We get calls from law enforcement officers in Lexington. I work a couple of shifts so far, and I'm just amazed at how many calls that we're getting and the services that actually needed in the different communities. So I would definitely share information. Jamila, I'm not sure whether I have that number, but it's a 24/7 call center that we have right here in the Charleston area. So we're excited about this.
Okay. All right. Well, kind of flying. We do have a lot going on in this chat box. I am so excited, and our panelists can see these questions, and there are some that have been answered directly. I'd love to be able to get everyone's question answered on the camera, but they are being answered. Also, if you continue to have questions, if you're on this and you think of something after this is over, you have all the panelists' contact information, also links to different avenues for help that you can get after this is over. So I did want to wrap this up with one thing, and I noticed in the chat someone said, "Hey, I have a master's. Where can I get a job?" Right? So that that was right. So that was answered in the chat, and we're happy to hear that. We do need more people. We do need more people of color in all areas of healthcare. I am an infectious disease nurse, and I know that it matters. We need a plethora of people. We need myriad people in healthcare so that we can address and identify any type of issues that our communities need. So with that said, we're going to wrap up the chat session, and we are going to turn it back over to our wonderful chair for AALC, and that would be Sonya Hansen. And Sonya, you got it.
All right. I just want to say to everyone this morning that this has been awesome. To every one of our speakers, again, Sonya Jenkins, Karen, Mr. Oliver, Yolanda Sanders, and Camilla Fraser, thank you so much for being here this morning. I don't know about you all, but I have learned a lot. But also, I think it's all about, again, our community and being able to get something that will empower us and grow us. And we have all learned something today. The greatest part about what we've done today is also we have a resource, again, reference guide that is in front of you right now. And of course, this is recorded. Again, you can go right to tuw.org/AALC. You can see this whole presentation again. Please share this information. This is not just about us, but again, you can share it with those that you know so that you can empower somebody else to be able to understand mental health, especially within our own communities. So I just want to give a special thanks to all of our guests who are on today. Again, we still have 54 on our actual day call. So Steph and I can tell you we are excited and happy that you were able to be here with us. I can tell you there's definitely more to come on this topic because it is, again, something that we need to explore even more. I know for me, I definitely want to get more training. So thank you, ladies, for being engaging throughout this presentation. Thank you again to Stephanie, who coordinated this for us as far as our speakers, the topic. Again, she is an amazing vice chair, as you all know, and again, my right hand and left of that. And thank you again to Amy, Howard, and Terry. A special thank you again also, very, very special thank you to all of our AALC members. Again, we do this every year for a reason because we want to impact our community. And once again, we've done it. Thank you all. We appreciate you. We're going to end a little bit early and give you some more time back on your day. You have the resource guide, but again, this is also recorded. And in the meantime, we just want to say to you on behalf of Stephanie, myself, AALC, and Trident United Way, we hope you have a wonderful day. Be safe. We appreciate you, and I hope you have a wonderful, wonderful afternoon. Have a great day, everyone. Thank you so much, Sonya and Karen.
Yes, thank you.
Thank you so much, Ms. Frazier. We are so grateful.
Thanks, everyone.
Thank you, Jamila.
Bye-bye, Jamila.